according to government commitment to ending HIV/AIDS is in 2030, where they aim at fighting the disease among the different communities across the country. Despite the efforts to end HIV, according to the numbers from the Uganda AIDS Commission, there is worry that the fight may not reach 2030 due to the high rate of those acquiring the disease.
Yes, we have made progress, but there are still challenges, and we need to unpack this.
Today, representatives from the Inter-Religious Council have had a dialogue on how these diseases can be prevented at community level. They noted that government fight against this disease has reduced, which worries the country as well as the economy.
In the last line of defense against disease and the first point of care. Yet, as the burden of care increases, our traditional funding models are being tested.
Donor support has been valuable, but we must build sustainable local financing models. Let us prioritize accountability. We demand efficiency in using public resources and commit to working with the government to eradicate leakages in the system.
They note that to achieve the goal of ending AIDS by 2030, sensitization needs to be done to all people and, if possible, in sermons at the different churches and in mosques.
And I'm wondering why you don't use our structures, you don't take advantage of them, you don't use our media, our fellowships, our platforms, our pulpits on a daily and a weekly basis. Really, you should be the ones to name where you want to use us. Don't ask us to offer you what we have.
Church religious leaders is to engage with the community. The structures are there from the grassroots to the top. There are churches, mosques, they have other institutions, they have schools, they have groups for the youth, for the women, for the men. So the information and sensitization can be carried by the religious organization through the structures to reach everyone.
Now, officials from the Ministry of Health noted that efforts are underway to fight the disease so that the health of the people is guaranteed.
So we are at advanced stages of doing some studies where we can come up with serious analytical reports which we can present to Ministry of Finance to see that if you invest in health, you are going to get ABC dollars ultimately. $1 in health will give you this amount of dollars. Once we have that case, we should be able to stand and walk in and say, put this amount of dollars in health, you're going to reap in this way. First of all, you have the jobs because you are employing people. You'll have a healthy population, meaning the productivity will be higher.
Maria Jacinta Kanyange, NTV.